Everyone, it's Dr. Gospel Potokin here, the Medic Coach. You're welcome to today's episode of On Becoming a Doctor. Before we delve into the subject matter of today, you want to make sure you subscribe to this channel, turn on notifications, like this video, and share with your colleagues and friends and every clinical student that you know. If you're watching this on Instagram, please ensure to follow us. Thank you. So today we'll be talking about making the most of your clinical years, and we're going to talk about this cutting across being proactive, interacting with patients, interacting with other members of the health team. Do not get overwhelmed. And also we're going to talk about Bloom's taxonomy, the levels of knowledge and everything surrounding that. But before we delve into the subject matter of today, I want to talk to you about the path to competence, so you can quickly do a self-assessment and know the level which you're in currently. So in the path to competence, we have the ignorant clinical student, we have the incompetent clinical student, we have the competent clinical student, and we have the excellent clinical student. In between the incompetent and the competent clinical student, we have the borderline clinical student. So who is the ignorant clinical student? The ignorant clinical student is the student who might know about but cannot perform. So this person might have watched maybe an examination or a procedure being done, but he or she has not rehearsed or practiced on his or her own. The incompetent clinical student actually knows how but cannot perform. So this person has not mastered the art or whichever skill is being in question here. For the competent clinical student, this person knows how and this person can perform. For the excellent clinical student, this person not only knows how and can perform, this person can do so with speed, with a very high level of proficiency, and without missing any steps sequentially. So the question is left for you: which level do you fall in? Are you ignorant? Are you incompetent? Are you a borderline clinical student? Are you a competent clinical student? Or you're an excellent clinical student? So coming down to the subject matter of today, one of our lecturers told us back then in school that clinical medicine is for the self-directed and the self-motivated student. And I can tell you for a fact, this is absolutely true. Because, like I said, one of the first things you want to do is to be proactive. Now you're treated as, in quote, an adult. So it's not every time you'll find someone trying to force you to learn. So you have to take measures to make sure that you're making the most of your time in the wards, in the clinics, in the theater, wherever you find yourself. So part of being proactive would include making sure you have learning objectives, introducing yourself to the team when you appear on your first day of the posting, interact with your attendings, interact with the residents, let your personality shine. Yes, do not go overboard, because there are other members of your group, but just let your personality shine. Raise up your hands to answer questions if you know the answers. Raise up your hand to ask questions when you're not clear. I can tell you for a fact, it's best you learn things on the spot while you're in the clinical classes. So you want to make sure you are proactive. Always be 10 steps ahead. The next thing I want to talk about will be making sure you are improving across the different areas you will be assessed in. So essentially making progress. So when you outline all the components of the clinical exam assessment, let's say history taking, physical examination, communication or ethics station, the procedures, your essay exams, everything, make sure you're making sequential progress so that there are no gaps. Anytime you notice that there is an area where it seems as though your competence level is low, you want to invest a lot of time in that region to bring everything to the same level of excellence. Make sure you interact with patients. If you're not interacting with patients as a doctor, you are like the sailor that never went to the sea, and that person will turn out a dangerous doctor. So interact with patients, examine patients, take histories, and act within the level of your competence when it comes to performing procedures. Any procedure you cannot do or you've not observed, tell the registrar, the resident, let them teach you while you perform under observation, and then you can now do it on your own over and over again up until the point where you've actually mastered this skill. Next is you want to interact with other members of the health team. Like I said before, the residents are going to be putting a lot of knowledge into you. So you want to volunteer to help them in some instances. It's not just for you to be receiving knowledge over and over and over again. So at the points where you can become of help to them, please be of help to them. And I have to remind you at this point, there is a tendency to get overwhelmed. Please do not fall for it. You have a lifetime of practice ahead of you to learn something. So don't get into the trap of being anxious that I didn't learn this, I didn't get to do this, I didn't get to do that. You have internship ahead of you, you have residency ahead of you for those of you who want to become consultants or attendings in future. So calm down and don't put yourself under too much pressure. You also want to find time to study. I discovered that it's very easy to be busy and unproductive during one's clinical years. You're everywhere. You're in theater, you're in the wards, you're in the clinics, you're everywhere. You're on call and you have everything to do. Good and fine. Please be present for all these activities, but find a way to study. As you're going on your daily activities, maybe in the bus, in the hostel, find time. Always find the little pockets of time to do the little bit you can do. Actually, just do little every day, no matter how little, and it will all amount into being much. On the days where you are free, or on the days when you are free, capitalize on those times to do the very difficult concept or the very bulky courses. It's important, and when you're planning, be very strategic to make sure that your study plan covers all the areas of the exam. Lest I forget, you want to make sure that you're working with a team in your clinical years. Yes, some people say they prefer to work alone, but I believe together everyone achieves more. So make sure you belong to a group. Ideally, 4 persons are enough, where you get to share knowledge, you encourage one another, and you do all that is necessary for you to succeed when you go for your exam. You want to make sure you're acing your exams at first sitting. It's very important. And you know, in clinical school, in addition to the usual theoretical exams you have practical exams, the one we call clinicals. And in modern day, it's called the objective structured clinical exams. Now, this exam is different from the regular exams you write because you're not just being assessed based on your knowledge, but you're also assessed based on your ability to perform. You need to demonstrate that ability to perform for you to pass the exam or for you to even be excellent, for those who want to function on the level of excellence. Now, some things you want to keep at the core of your mind while you're in your clinical years to ace your exams will be, you want to practice a lot. Engage in role play scenarios, ideally 3 persons, 1 person serving as the examiner, the other person the patient, and the other person the student, in quote now, doing whatever skill will be assessed during the exams. Make sure you are performing in exam standard time. On the day of the exam, you might be given 5 minutes, 6 minutes, 7 minutes, 10 minutes, whatever it is in your school, but practice with a time that is either exactly that or less than that, so that by the time you've done it over and over again within a shorter time frame, on the day of the exam, that particular station would actually just be a walkover for you. Again, you want to be holistic and logical in your approach, because having prepared for a station, for instance, there might be slight modifications and it's easy for one to become tensed and just fumble in that station. But if you have a pattern and if you're always logical when you are approaching the different stations in the manners that they come, you're always going to get at least 70% of the marks for that station. So make sure you're logical in your approach to answering the questions. Role play scenarios, practice, fine-tune your skills, and be logical in your approach in order for you to ace your exams. The last thing I want to talk to you about is the Bloom's taxonomy. In this taxonomy, we have knowledge, we have comprehension, we have application, we have analysis, we have evaluation, and then we have sentences. Now, what this does is it outlines the different level you're expected to be performing as you journey through your medical career. For a clinical student, the minimum for you is the level of application. This is where you utilize the knowledge you have. So what knowledge essentially means is when you've obviously understood something first, but it has now become a part of you. Not really cramming, but maybe memorization. I would prefer that as when it comes to the choice of words. So you own that knowledge now. And the best way to go about gaining knowledge is through active recall, amongst the other reading strategies that you would know. For comprehension, the proof that you've understood something is your ability to teach it to someone that is probably not even in your level, maybe even a child, and to break it down for that person to understand. Now, application, which is where you should be functioning from, is your ability to use knowledge. So you've read a topic very well. Now you want to use that to make a diagnosis. A patient presents with this symptom, this sign, and all of that, and you put everything together and you say, oh, this patient has also disease. You've utilized that knowledge to make a diagnosis. That's an example of application. When we come to analysis, it talks about differentiating or answering the question why. So let's say a patient is having complications and you're trying to think of, oh, why is this patient having complication? Is it because of the drug? Is it because of the disease process the patient is undergoing? And putting all of that in perspective, that speaks of analysis. Evaluation is trying to confirm or verify based on something. So let's say you've made a diagnosis. Popular, you should know, is the diagnostic criteria for heart failure. Let's say Framingham's criteria, for instance. Or you've made this diagnosis of a patient having heart failure and there are doubts. So you're bringing the symptoms and signs again to look at Framingham's criteria to verify if this patient actually meets the diagnostic criteria. That can serve as an example of an instance where you'll be evaluating. For synthesis, it means you're creating something new entirely. Now, this will be formulation of treatment plans, a classical example of that. So you want to be functioning from the level of application. Make sure you utilize knowledge. Any knowledge you've not utilized, you actually do not own it. That's why sometimes people go for their clinical exams and they go to a station and they discover they are blank, or they start answering a question, and because all the stations are timed, they may not be able to finish. So you want to utilize the knowledge over and over and over again to make sure it has become a part of you. As a clinician, the minimum level you are expected to function in is at the level of application, and it's a bit more difficult as against just lying on your bed and reading and putting all the information in your head. You have to go the extra mile to use every information that you have. So thank you very much. We've come to the end of today's episode of On Becoming a Doctor for clinical students. If you have any areas, questions you want me to address, please put them in the comment box. I'll be very glad to address them. Again, don't forget to subscribe to this channel, turn on notifications, like this video, share with your colleagues, your friends, every clinical student you know. If you're on our Instagram platform, please click the follow button. Once again, it's Dr. Gospel, the Medic Coach, and I'll be seeing you on the next episode. Thank you.